I am a health and wellbeing specialist. I work for ECIS. We are the company that look after and facilitate the JIB benefit credit. So that's the series of employee benefits that your operatives will benefit from and utilise. So I have been asked to speak about a specific subject today because, again, I could obviously talk to you for hours about health and wellbeing. But one thing that I think was alluded to as part of the presentation from Birmingham Council, and Alistair himself said earlier, is obviously about sort of mental wellbeing. But I really need to start off by just talking about health. How much have you heard about health in the last 2 years? Probably never talked about it quite so much in your life, have you? So crikey, what a 2 years it's been. Alistair, if I say to you health, what pops into your mind straight away?
Physical and mental.
Physical and mental, okay. In terms of?
I'm not active how I should be.
Okay.
Okay, so I'm unfit, and if I had my normal health checkup, I'd probably be overweight or too small. And then mental well-being because of the work-life balance and everything that goes with, 3 kids and yeah.
If I'd asked you 2 years ago, prior to the pandemic, do you think you would have included mental well-being in your response, or do you think it would have been more?
Not as much as.
No.
Yeah.
So there are some good things that have come out of the pandemic, to be fair. And one of them is actually it's probably moved awareness of mental health on probably 15 years. We were starting to get to a point where actually it's definitely been something that we've been thinking about more, but it's still really had a stigma attached to it, which I think has obviously been the biggest issue. So let me ask you a question, and again, show of hands, don't be shy. What do you think is the biggest cause of death in men under the age of 50 in England? Suicide. So scary. So there's a number of you in this room that actually the thing that would be most likely to kill you right now is you. Didn't want to bring the tone down a little bit, but we do need to kind of recognise that it is something serious. But there's such a link as well. Something we never seem to have really got to is your physical and your mental well-being are inextricably linked. Now, if we look at what the World Health Organization says, their definition of health is that it's physical, mental and social well-being and not just the absence of disease and infirmity. So it's not just about, oh, I'm not poorly, so I'm okay. They wrap up mental and social well-being in overall health. And it is overall health. There's no point in saying, well, physically, I'm a wonderful specimen. Look at me, I can bench press and everything. But actually, if mentally and if you're in your social interactions, you're not good, then it's still going to have a really bad impact. So it needs to be treated with the same importance. So let me give you an example. Anyone in the room ever had flu? Yeah, hands up, a few of you. Flu. To be fair, you've had man flu. That's really bad. You need an ambulance on standby if you get man flu. Shocking. So, how did you feel? How did you feel when you had your flu? Rubbish? Yeah? Yeah? So, physically, shaking, feeling really under the weather, couldn't get out of bed. How did that affect your mood?
Well, obviously you just feel a little bit incapable of doing your day-to-day tasks and just function,
So you feel fed up? Yeah? You're not exactly happy, are you? You're not bouncing off the walls. If you've got flu, you're not going around telling jokes. You're not excited going, God, I feel good today. You feel down, you feel fed up. And our mental and physical well-being do go along like that in our lives. So I could probably say to all of you, and we could do a nice little map, which I won't do because I'm aware that we're tight for time, but I could go along and say, you've had a cold, your physical well-being has dipped, you've then gotten better, you've come back again. Then it might have been you've broken a bone, at which point your physical well-being's dipped a little bit more, but you've gone to see a doctor, you've had the bone set, you do your physiotherapy, you're back to good physical health after a while, and then it could be something really bad, like maybe cancer, which then would really take a big dip in your physical health. Agree that? That sounds about right?
Yep. And
we'd all accept that? Yeah, we'd all be happy if someone sort of came to you and said, oh, I've got flu, I can't come into work today, broken a bone. We'd be okay, wouldn't we? Yep. If someone turned up at your office and sat you down and said, I've just been diagnosed with cancer, you would never turn around and say, get over it, come on, man up, deal with it. We would never treat someone with a physical aspect like that. But our mental well-being is exactly the same. It can be absolutely fine, and then maybe, a couple of days before payday, something major happens, your car, your timing belt goes, oh, there's 800 quid, you're like, damn, I don't have that money right now. So your mood might dip, you get a bit stressed, fair to say. But then actually, oh no, I remembered I put some money in the savings account last week, I can do that, that's okay. So your mental well-being comes back up again. And then something a bit worse could happen. Maybe you break up out of a relationship. We feel down a bit for a while, don't we? And then with time, with our friends, us girls, we have our girls come over. Prosecco, bit of ice cream, Ben & Jerry's if we're feeling like it. And your mental well-being starts to come back again. And then of course it could be something like a bereavement, losing somebody. And we maybe see a counsellor for some grief, support, again, our friends rally around us, and with time. So can you see the correlation in terms of how your physical and mental well-being goes? So we need to also treat them with the same importance, especially when you consider that 17 million working days are lost each year due to mental well-being. And let's be honest, there's probably quite a lot of people that don't phone up and say, I'm having a bad day today. I'm feeling stressed, I'm feeling anxious. So there might be a lot of situations where actually people are not saying exactly why they're not at work. So that number could actually be higher. And it's the stigma. That's why we're normally uncomfortable about saying. Like I could skip in here quite happily and go, I had COVID, it was rubbish, felt awful. And I wouldn't worry about that at all. But I probably would worry about coming in and saying, I had an anxiety attack last week. I was putting up a presentation and I thought, oh my God, I can't go in. I can't go in and talk in front of all of those people. I wouldn't feel as comfortable doing that because I'd be worried about what you would think of me. If you knew it was something physical, there'd probably be a certain amount of empathy. And we need to really start getting to that with mental well-being. What impact do you think COVID had on people's mental well-being?
Substantial.
Yeah, you can imagine it, can't you? There were those of us that maybe lived alone. So literally for weeks on end, we're not seeing people, and human beings are not designed to be isolated. How do you punish someone who's in prison? Someone's in jail and they're naughty. Solitary confinement. We are not designed to be isolated. It's not good for us. Those of us that had family, oh my God, how nuts did your kids drive you? Yeah? No time alone. Again, we can't go too far the other way. So no matter what, COVID was a difficult time. And if you look at it, since May of last year, 1.4 million people were in contact with mental health services for support because of their mental well-being with COVID. And if we look at data from the Office of National Statistics, depression rates have doubled since the pandemic began. Now, people, I think the good thing from this is that people are actually more willing to talk about it. They're more willing to ask for help. Again, what I always find incredible is, like I said, if I broke a bone, I wouldn't be saying, oh, Amanda, do us a favour, can you get some duct tape and a bit of wood and just knock that out for me? That needs to be sorted, thanks ever so much. I would go to a hospital. I would have a medical professional help me to ensure that the bone healed correctly. And yet there is that thing of if I'm not feeling right, if I recognise that actually I'm not happy, this has been going on for a while, because again, it's not just a case of a low mood, we all have that. But we're talking more if we're looking at depression and anxiety. Again, we seem to be reticent to go and see a professional to help us with that. But there are so many support mechanisms available, which I will be talking about. So 40% of people, does it feel a little bit now? Put your hand up and be honest that you almost feel a little bit like everyone's now just got to be back to normal. Yeah, COVID never happened. We're all great. We're back to normal. I hate to say it, it's normally not quite that easy. You can't have this massive change in life and then all of a sudden things just go back like it never happened. And lots of people are still concerned. Feelings of isolation haven't gone back yet. 32% of UK adults are worried about their finances. Admittedly, I got this stat from a little while ago. I dread to think what that figure would be if I did it this morning. 98% of adults are worried about their finances. If there's anyone in this room that isn't kind of going, petrol, £2 a litre, honestly. And obviously the concerning thing is that some people have then, naturally, we look at coping mechanisms. How do we deal with these things? And unfortunately, now luckily, I'm a teetotaler. That means my way of coping after a bad day is a nice hot bubble bath. But for a lot of people, alcohol consumption, obviously drugs, even other addictions such as gambling, anything that kind of made us feel that bit better when we were in that situation. And because we couldn't go anywhere, obviously a lot of those things would be at the tip of our fingers. And then even now with more socialising And I do know in my friendship circles, a couple of friends that have really struggled to kind of come back out into the, you fancy coming down the pub? Don't be wrong, even I love being around people, but you get to those days you go, oh, I just don't think I can do it today. It almost felt a little bit, if I'd been around people for a day, almost felt like I needed to go home and have that space, because again, being around, I wouldn't have even thought about that 2 years ago. I'd be like, yeah, girls' night, you know. So it is having an impact, and this just gives you an idea. So if you look at the blue is 2019 and the red is 2020. So if we look at the rates now in terms of depression, and again, I think this very much feeds into what you were saying about young people. And we know they haven't had the youth that they should have done. They haven't been able to graduate from university and have those experiences, and it is because they are at a really vulnerable point. It's been difficult for us, but we've got our lives and we've got our maturity as adults. They're in the process of learning all of these aspects and learning about social interaction and things, and they've missed out on so much of it, and it really demonstrates, I think, in terms of the statistics that back that up. Okay, so most common issues: stress, anxiety, depression. You probably would have all had a pretty good idea about that one. And as we've talked about, things like losing people, loss of income, bereavement, lack of privacy, fear. I mean, this is something we don't really talk about. There are a lot of people that were scared. They genuinely became scared about, am I going to be here? Am I going to survive this if I get it? That could be a real concern for a lot of people. And when we're looking at something like stress, now we all get stressed. I'll let you all now know, and hopefully it'll make you all feel really good. Stress is natural, don't worry. We all have it. It's part of our physiological reactions to things. Have you ever had someone pull out of you in front when you're driving, and they pull out in front of you really quickly? Slam your brake on. Stress reaction. Good. Stops you crashing into a car. She's good. Now, the thing about stress, it actually can really be beneficial because it can motivate us, it can drive us. And there are those of you that actually find you work better if you've got a deadline. Yeah. So it can be a good thing until it's not. And obviously that's where the tipping point comes over. Now, stress also can really affect us physically. Personally, my thing, I hold my stress here and here. I do this. I don't literally walk around doing that, but that's where I can feel it. And then I start getting pain all around my neck area, my shoulders. It starts affecting me physically. So it really does have, again, the physical impact on it. Again, anxiety. Now, to let you know again, anxiety, completely natural emotion. We all have it. It actually is something that at times can help save your life because it's effectively our fear reaction. So if you were at the edge of a cliff on a really windy day, your anxiety would, you take a step back because that's how your anxiety works. It stops you from getting yourself in dangerous situations. Again, the difficulty is if the length of the anxiety, the intensity and the impact it has on your life is too long, that's when it tips over into an anxiety disorder. And it creates issues such as cardio issues, memory loss, avoidance of situations. And then depression, again, there are the ICD-10 has a list of symptoms, if you like, and it will say if you have a minimum of 2 of those for a period of 2 weeks consecutively, that's when you'd be starting to look into becoming depressed. And that is things like you're eating, you might be eating too much, too little, not sleeping, sleeping too much, difficulty concentrating, all of these kind of things lead into that. And again, it has a real impact. So what is stress? It's the most thing that we'll deal with. So as I've said, it's about your body's response to feeling threatened or under pressure, and it releases hormones. So you might have all heard of the stress hormone cortisol. Yeah, so you get a lot of cortisol in your system, cortisol's going, that's when your stress levels can really go up, okay? So again, we'll look at ways of dealing with that in a moment. So by show of hands, put up, what do you think are the 3 causes of stress today?
It's 2.
Financial is one of them, yes. Time is something that does cause stress, but it's not one of the top 3. Work. And relationships. Yeah, relationships, money, and work. They are the 3 main causes of stress today. It's interesting, if you look at sort of from 20 years ago, they were different. Finances weren't quite such a big aspect, and neither was work, but obviously today They are really, really important. And it comes in many forms. As I've said, you might hold your stress physically, environmental, emotional, acute life events that happen. So stress is a really big part of our life, and it is important that we look at how we can deal with it and things. So let's talk about the support available. Now, I'm at a JIB event. It would be very lax of me if I didn't obviously talk about the fantastic benefits that are available through the JIB benefit credit. And that's really obviously what I'm wanting everyone to take away with them today. So it provides private medical insurance with Bupa. I don't need to say, do any of you know who Bupa are? Because unless you live under a rock, you know who Bupa are. The UK's largest PMI provider. And the policy we have is it's a really comprehensive policy. So it really is there to support the operatives. So Bupa do have the most extensive health cover in the market for mental wellbeing. And that's their claim to fame, okay? So that's from them. So what does that mean? So firstly, you've got the Babylon Virtual GP. Anyone here had to go and see your GP in the last year? Challenging? Yeah? Can't? No.
Not accessible.
There you go. And we're in a bit of a situation that even if we need to see the GP, we might be a little bit reticent because we're thinking, oh, I don't want to take the time away from them. Some GPs still don't actually have face-to-face appointments, but we need to see GPs at times. It's just a part of life. So the Babylon Virtual GP, 24 hours a day, 7 days a week. So no more if you sort of, 10 o'clock at night, you're thinking, oh, I really don't feel well. You're not thinking the GP service wakes up at 8:30 in the morning. I'll be there on hold, dial, dial, dial. You can access it at any point. It's an app on the phone, and literally you go on, look at your appointment time, and normally you can get an appointment within 2 hours, but you will definitely get an appointment within a day. So the times that I've used it, I've always managed to get an appointment within an hour. So, and the service is fantastic. You will speak to a GP the same way you would your normal GP. They can provide prescriptions, onward referral, advice and guidance, exactly the way that your GP would. Face-to-face counselling. So I mentioned earlier, if I broke my arm, I wouldn't turn around and ask Amanda to fashion me a splint. I would speak to somebody who was professional and who knew what they were doing. And it's the same if there is a mental aspect, that we need to speak to people who can provide us support. Our girlfriends are fantastic, ice cream and Prosecco. Our male friends are great. We'll go and have some rugby and maybe have a beer. Not wanting to sound like I'm putting everyone in their little opinions there. But great, your friends are support. But they're not professionals. They're not there to understand fully and know the best way to work and support. So the face-to-face counselling that's available through the private medical insurance can do that. There's also 45 days inpatient cover. So if somebody does require more consistent support, there is that available to them as well. And that might either be as a day patient or as an inpatient. And the Employee Assistance Programme. So this is a counselling helpline. Again, this is available 24 hours a day, 7 days a week. And I actually had someone that came to me and had said, do you know what? I hadn't even thought about it. And you did the presentation, had been really having trouble sleeping. So 1 o'clock in the morning, phoned up the EAP, talked about what was on their mind and was like, it was great. I was on the phone to them for about half an hour, went back to bed, slept. First time I slept in a long time. Because of course, everything doesn't always happen between the hours of 9 and 5. Our lives sort of carry on. So being able to access support when we need it is the really important thing. So your guys can access this at any time. And again, when I've done presentations, and I've done them to operatives, so we also run mental health workshops. And when I've presented at the workshops to a group of operatives, and they've actually then spoken to me afterwards and said, I was actually feeling really anxious when I was turning up to site. So I'd phone the Employee Assistance Programme when I arrived on site, and then I'd be able to talk and discuss with them, and then I'd feel ready to get out of the van and start my day. So being able to have that access is really, really important. So there is a lot in terms of the benefit credit that provides that support to your operatives for their mental well-being and their physical well-being as well. I don't want to forget that. As we said, mental well-being can have an impact on your physical well-being. So obviously there's a lot of support for the physical side of things too. And it also does pay for sick pay insurance, personal accident, which includes accidental death benefit, death in service and occupational health funding too. Now I am just going to leave it there. There are my contact details, so if anyone does have any questions or would like to talk to me, please do feel free to either give me a call or drop me an email. But the way I'll just end today is, you may be aware it is Men's Health Awareness Week this week. Does any of you know that? Yeah. So we are predominantly a room of gentlemen. So, and the whole point behind that is very much effectively having an MOT. So again, we would always really encourage, and I would encourage you to encourage your employees to just always get something checked. Again, your operatives have the private medical insurance. It's there for them 24 hours a day, 7 days a week. If they are concerned about anything, there are direct access services, which means for any worries about cancer, musculoskeletal, cataract, they can phone Bupa directly. They can use the GP line. There's lots of other remote services. There's a cardiac remote service, a skin remote service. If they are worried about anything, I would really say, please, for the sake of 10 minutes on a phone call or a 20-minute conversation with a consultant or a doctor, it really, really is worth it.